Clinical trials help build a healthier future, and there are several going on right now looking for patients. Dr. Joseph Gimbel with Arizona Research Center is here with some details. Always fun to see you. What do you have going on now? You're so busy.
We're always busy. Yeah, we're doing a lot of interesting trials as usual. We're doing, we just started a low back pain trial, and obviously a very common problem. I see most of the patients myself. They get a free exam. If they need an MRI, they get a free MRI. And if they have a herniated disc causing their problems, then they will get a free epidural steroid injection as a result. And what we're testing is a new drug, which is a much safer product than what's on the market right now. And patients are really doing quite well with it.
That's amazing. You've also got a hip study going on with some cortisone injection?
Right, it's a cortisone shot. Hip arthritis, to inject a hip, you need to do it under fluoro because it's a difficult joint to really inject. So we're doing a trial with a time-release product that gives much longer relief from cortisone than the typical cortisone does. And because it's time release, you don't get that initial flare from cortisone, especially with diabetic patients that have elevated blood sugar. This product helps avoid that type of problem.
Now, bunions are another big problem. Darn those things. Well, you're working with those as well.
Yeah, we seem to do quite a few of those throughout the year. And what we do is we see the patients and they have their bunion surgeries at no cost. So it's free. And then we keep them for a couple of days in our facility, and there's no charge to the patient at all. And then they go home ambulatory in a boot, and they do quite well. So we're always looking for patients that have problems with their feet, and we're happy to evaluate them and see if they would qualify for our bunion studies.
Now, you have a Refer a Friend program. Can you tell everyone a little bit more about that?
Well, if you have a friend that has a bunion, and you just call and tell us about them, and we go and they come into our program, we give the patient, the referring person, $100 for referring a patient. So,
holy cow, I got to think about who I know with a bunion.
Well, you go around and look at people's feet.
I spy a bunion.
I spy a bunion.
Now, let's talk a little bit about stem cell treatments. You're using that for shoulder rotator problems?
Stem cells, there are very few trials that have been approved by the FDA. And this happens to be one of the first shoulder trials that the FDA has approved for stem cells. And we're treating patients with rotator cuff tears, and we're seeing improvement, reduction of scar, and improvement of the tear. And most of these patients are avoiding surgery as a result. So it's an exciting trial. There's been a real lot of publicity for stem cells. So.
Yeah, and we've also got treatments for knee pain as well.
We're doing about a half a dozen knee studies right now for all different, from all osteoarthritis to the knee. Anywhere from a product that takes the stem cell in your knee, we're not injecting the stem cell, and converts it into a cell that makes cartilage, which helps your knee heal and also helps with pain in the knee. And we have other products that we inject for pain and other products orally to repair cartilage and to prevent destruction of cartilage in your knee.
And we mentioned it before, Refer a Friend.
Right.
Now, is that only for bunions, or is that for any of these?
Any program.
All right, so for any of the programs, you can get money for referring a friend that has one of these plethora of issues that we've listed here.
You can also get well.
Yes, you can. All right, Dr. Gimbel, thank you so much.
Thank you. It's been a pleasure.
If you want more details, you can visit azresearchcenter.com or call the number on your screen.